point out, Dr. Orient is a practicing internist in Tucson, Arizona, as well as the executive director of the Association of American Physicians and Surgeons. And deep in her background, she also has some experience with government medicine, don't you?
Well, I was a government doctor for about 4.5 years. Really, I have more than 8 years of experience in the government system called the VA, if you count my residency. But there was some problems with my basic job description. It was fairly shocking for me to hear from the administration, which pointed it out from time to time, that my job was really not to take care of the veterans, but to be a gatekeeper. When veterans would come in to apply for treatment in our unscheduled clinic, we were supposed to answer 2 questions. First, was the veteran there for a service-connected disability? And the answer to that question was almost always no. Then the next question was, does the veteran have a situation that could imminently cause hospitalization if not treated? The answer to that was usually no. And in that event, we were supposed to send the patient away. But we just didn't do that. The clerk at the desk could have seen that and sent them away before the poor man had sat there all day waiting to see us. And it just really seemed absurd. The veteran had been there all day. We had taken the time to evaluate him. It was much easier to write him a prescription or to order a lab test or to do something that might remotely be helpful than it was to just send him packing. So that's what we did, although we really were violating the rules for each and every veteran that we treated.
Physicians can no longer allow medical care to be controlled by government and insurance companies. Current reform options purport to be cure-alls for every American. But we know that every patient is different, and just like patients, there is no single, big government solution to change healthcare in this country. Go to takebackmedicine.com and sign the petition.